and validation process. And this should further, develop into the availability of benchmarks for government performance, but benchmarks for development partner performance, agreement on aid modalities, and process for resolution of non-performance and disputes. If you look at what we hope to achieve, which is the box on your right, is to have, through this, a country-based national plan, based on the three ones that I mentioned: flexible and aligned country cycles, alignment to the budget, which we don't get a lot now, and accountability to country citizens. I'll come back to the accountability to country citizens in a moment. Through the Common and Monitoring and Evaluation Framework, we hope to move from inputs to process to outputs, and I'll focus on the last part, where the impact would be to have improved survival, child mortality, maternal mortality, improved nutrition, which is a big area for us at the moment, reduced morbidity, improved equity, and social and financial risk protection. So here we're really trying to focus on the results. It's not just a process. It's not about inputs. It's not about outputs. But in the end, it's about the impact that we make. How is the IHP managed? What is the structure? And this, to me, personally, wasn't that clear myself, but I'll try and explain it. One of the perhaps more unique things about the IHP is that there is no secretariat. So I noted that you were looking for somebody who worked for the IHP, and I was described as working for the IHP and the World Bank. There is no secretariat of the IHP. What you do have at the center is an interagency core team, and the interagency is made up of World Bank and World Health Organization staff based in the headquarters of the World Bank, Washington, D.C., the WHO headquarters, Geneva, and WHO's office in Brazzaville, Congo. And these teams together form, these groups together form the center of the IHP. And it's actually responsible for coordinating on a day-to-day basis how the IHP would work. Above that, you have the political advocacy, the health aid organizations, the UN. You have a very important structure called the Scaling Up Reference Group, which is going to involve business groups on one hand, but in addition, one group that is missing there is civil society. We've just agreed to have civil society involved under the point 1 in business, and then to also have civil society as part of the steering in the Scaling Up Reference Group. And the Scaling Up Reference Group is supposed to provide oversight on the IHP and also address its governance issues. And then you have the interagency working groups, which are going to be looking at different themes related to health and would provide the inputs into it. And on the right-hand side, I would say that perhaps the most important part of it is the interagency country health systems, because we very much want the IHP to be a country-based system. So those who are going to do the real work are these teams, and these teams are going to be made up of, as you see, ministries of health, finance, civil society, importantly, bilaterals, multilaterals, and international health agencies. And they're all sort of going to be fed in by civil society and the interagency working groups. At country level, another complicated chart. The IHP is going to deliver what you see in the box there. Hopefully, it should provide long-term predictable financing, fix health systems, provide a common review process, and a common monitoring and evaluation process. And through this, the groups that you see on the left are going to do this, but also it's going to be based, most importantly, on existing country mechanisms. Through this, we hope to have a scaling up of effective coverage, and finally, most importantly, the last bar, improved outcomes for MDGs 1B, 4, 5, and 6, and perhaps even 3. Now, for me, presenting this at this meeting is a very important aspect of the development of the IHP. Civil society's involvement in the IHP was foreseen from day one. And as we have been developing this, there have been a number of consultations that have taken place. Some of you have been involved in some of them. We had a big video conference, which